will reopen on the 19th of April. This is based on the guidance of the Department of Health. We continue to work collaboratively with them, and it is very important to tell the general public that it is based on their guidance that this date has been proposed. The discussion continues. The health and safety and well-being of all of our stakeholders, our children, our teachers, our support staff, administrators, the wider educational fraternity remains paramount to everything that we will do. We are pleased that our early childhood sector has reopened. We looked at the 6th of April for our private educational institutions, and the public ones that are government-owned centers will open on the 19th. Our early childhood sector has been one that has not had the face-to-face interaction, but it is our hope that with strict adherence to all of the protocols, we can continue to provide a safe environment for all of our children, in particular our little ones in the early childhood sector. On the 19th of April, we hope to be able to welcome back our children for the third term, which is the shortest term in the academic year. Having missed out on a lot of face-to-face interaction, we noted the challenges associated with virtual and online distributed learning for our children, and so an opportunity for them to get back into the physical space, again, based on a safe environment for all stakeholders and under the guidance of the Department of Health. Our primary students, our secondary students, we hope to welcome them back. We know that there is some anxiety as many of them have been out, and in some cases we've had abrupt ends to the school setting. So through the Office of our Guidance Counselors, we are helping them readjust to the face-to-face interaction. But we also encourage our parents likewise. Pay attention to your children. Listen to them, speak to them about how they feel, but encourage positivity as they go back into the physical setting for the final term of this academic year. Our team at the Department of Education, our health and safety officers, have been on the ground. They have done school visits up to every district and every school. We have the reports on them in terms of readiness to receive our children. We are pleased that this is a continuation of the process that had begun in January, where we were prepared and various protocols had been put in place. Infrastructure in terms of hand washing stations had been placed. We've reviewed this, and areas where there was need for improvement, that has been done. The environmental health team has also been very good, working closely with us, in particular at the early childhood centers, and assessing them and also identifying the ones that are ready to receive children based on the adherence to the protocols. Our common entrance this year will be the final common entrance as we move into the CPEA. We will continue to engage our parents on this. We are looking at a June common entrance. The Registrar of Examinations will give further details to the general public. But we note too that our parents are concerned because some students have had more than others. Some students have not had access to the devices. So dear parents, we want to reassure you that we would not do anything to jeopardize the education of any one of our children. This is why we continue to consult. We continue to adapt. We continue to amend even our examinations to look at where the children were at in terms of what parts of the curriculum that they covered, to make sure that it is as fair and equitable to all of our children, and it really speaks to what they did cover, so that the examination is a true reflection of that level of validity and reliability as we speak to common entrance for 2021. Our secondary students, we need to improve upon the following and adherence to the protocols. We noted that in many of our school visits, our primary school students did a much better job. I have said it before. Our secondary school students need to support reference loitering in castries, taking public buses, how they adhere to the protocol. So there's a special challenge to our secondary students to actually do what is supposed to be done. Dear parents, We note that it is not business as usual. We cannot have parents simply coming into the school settings, in as much as we appreciate our parents and their involvement, their collaboration, but there are various protocols whereby our parents would need to call in advance to come to the schools, follow the protocols in terms of the hand washing, sanitizing as they come into the school setting to reduce movement of individuals within that physical setting. So we'd like you to work with us as you have done in the past, as you have entrusted your children into our care, to make sure that we can have a consistent third term for all of our children.
St. Lucia, like many other countries in the region, has managed a safe reopening of many sectors while managing COVID-19 in country. Health and safety has always been the priority while working with the various sectors. Over the past year, the Ministry of Health and Wellness has been working closely with the Ministry of Education to coordinate the safe, sustainable reopening of schools. The school environment is not classified as one of high risk. The school administration, with the support of staff, can work together to ensure a safe environment is maintained. Children under 18 years of age represent 8.5% of cases in the US setting and less than 5% in the UK and EU settings for COVID-19. In St. Lucia, children under 18 years make up to 9% of cases to date. Generally, this age group presents with mild or asymptomatic disease. There have been no deaths to COVID-19 in this age group in country. Current evidence suggests that children are less likely than adults to be transmitters of the disease, and child-to-child transmission is uncommon at schools. Schools have not been associated with significant increases in community transmission. Some of the considerations include the following: the continuity of education for the overall well-being, health and safety of children, the impact of school closures on educational loss, equity, general health and well-being of children, minimizing the risk of COVID-19 transmission within school and school-associated settings, reducing the risk of community spread from schools. In an effort to address these, the following have been recommended: the psychosocial support when needed to address fear and anxiety, medical support provided through the support of the community wellness centers, the availability of safe, effective vaccines to all staff of the educational sector, ensuring school-related measures are integrated and support measures implemented at the community level, the provision of accurate, updated information to staff and parents to counter misinformation, the training and sensitization of all staff members, and the management of stigma and discrimination at schools, the full usage of the education sector continuity plan at every school, which clearly highlights all of the protocols and algorithms in managing any issues at the various schools. We acknowledge and understand the concerns of all related to COVID-19, but we cannot act out of fear. We need to use the assessment of our local situation and ensure that the necessary measures are in place to move forward. Additional factors that are also considered include the harm that may occur due to school closure, the risk of the non-return to school by students, the widening disparity in educational attainment, limited access to meals, and the need to maintain schools at least partially open for children whose caregivers are essential workers. According to the World Health Organization, there have been few COVID-19 outbreaks in schools. From the studies conducted, the transmission was primarily related to social events related to schools rather than transmission within classrooms. The Ministry of Health and Wellness, through the use of scientific evidence-based data and using the epidemiological analysis on our national situation, will continue to work closely with the Ministry of Education as we prepare for the safe educational environment for all of our students, the staff, and the management of these institutions.
School councils for the Department of Education are preparing for the return of students into the classrooms on April 19th. We are excited to have students back in school. And so the councils are going through various reflections on what the program would look like so that students can be welcomed into school, so that students can be comfortable. We know that students are happy. They are excited and they are anticipating, the comfort of being back in their school environment with their principals, their teachers, and of course their friends. So when it comes to the school counseling program, we have a responsibility to care for the students' academic, personal, social, and of course their career development. But the most important factor this time is their social development. We really want to introduce the students into the school through some of our psychosocial programs. So what we may, and I'm saying may because each district is unique, each school is unique, and so the counselors along with the principals will determine the best program. We would take the students through a number of activities which would help them to reflect on how it was for them while they were out of school. They would get to share that. We would also take them through what they feel at this moment now that they are in school. And of course, we would point them towards the hope of being able to fulfill their education, to succeed, and of course, to rekindle the friendships that they had. We recognize that children will be returning, with anxiety. Parents themselves are also anxious. However, we know that parents want school to reopen and they are interested in providing the support for the teachers because they really recognize the importance of school. If ever we want the parents themselves to come into the program. We had done a number of activities with them throughout the time that they were at home, helping them to cope with anxiety, helping them to keep their children focused. We want them to know that that ought not to stop. They need to know what will be going on in the schools. They need to contribute towards the development of their children in the school, and we really want the students to make a safe and smooth return into their classroom. As for the teachers, we want to continue to give them the support the school counselors will, because their psychosocial and mental well-being is important. When the teachers are secure, when the teachers feel safe, when the teachers know that they're working in an environment where they are supported, they too will be willing to go forward and to do whatever is necessary for the children. We also recognize that there's been a lot of strain on the families. And so together with the school, we want to create a situation where the parents can talk to the counselors, give some information on what they've been through. We can listen to what they would need, and we could link them to where they may be able to get support, whether it is within the community or within, the services of the government of St. Lucia. The counselors within the Department of Education and the respective districts and schools in St. Lucia are ready and willing to continue to serve the children of St. Lucia. We have a number of programs that we have put together that we will deliver to the children. We will deliver with the help of the teachers, and of course we will deliver with the support of the parents so that the children can settle back into school, that they can become more stable, and that they can accomplish what they intended in the first instance, which is to be successful in their education.
The Special Education Unit in the Department of Education is excited that school is going to be opening on the 19th of April. We say that because one of the important lessons that COVID-19 has taught us is something that we already knew, that children with special needs perform best in face-to-face interactions within the education system. And for the past year, it has been quite a struggle for students with special needs. Without that direct face-to-face interaction with their teachers and with their peers, education has been a struggle. And so on the 19th of April, we are anticipating that all of the special schools will be fully open. We believe that most of, if not all of the students will be back at school having face-to-face interaction. We anticipate that there are some students who have more extreme challenges who may not yet be ready to start school, but we are actively planning and programming for these students. And we anticipate that even while they may not be able to start school on the first day of school, that the schools will make the necessary arrangements to continue providing them distributed learning support from home. Otherwise, we anticipate that the schools will be up and running, that all of the schools will be ready to welcome students back. There are plans to bring them slowly into the academic setting. And when I say that, I mean in terms of what is going to be done. There is going to be a need for re-familiarizing many of them with the rhythm of school, having been away for this long period of time. But all in all, the reopening of school is going to be a really good thing for students with special needs. We also think of the students with special needs in the mainstream schools who are being supported by special educational needs teachers. These children also will benefit significantly through the reopening of school, because the targeted one-on-one support that these special educational needs teachers would normally provide in the school setting has been difficult to accomplish through distributed learning. Even when there was an attempt to support students from home, we have discovered, and again we're reminded, that it is very difficult for parents to give the necessary support to children with special needs. Their learning needs are not that of the typical student, and so it requires the persons with familiarization with those learning needs to be able to give them the specialized support. And as much as parents love their children and care for them, instruction is something different. And so we are happy that students will be able to return to the school setting and get that targeted support from persons with training and experience in supporting the learning of children with special needs.
The early childhood sector has resumed operations as of April 6, 2021 on a phased approach. The private centers have opened and the government-operated centers will be opening on the 19th of April along with the rest of the education sector. However, prior to that, a lot of work has gone into ensuring the health, safety of those centers, and we have worked collaboratively with different agencies such as the Department of Environmental Health, who have been working closely with us to ensure that all centers, every early childhood center on the island has been inspected to ensure that they meet the stipulated protocols. We have a few centers who have not been inspected as yet, but we want to assure them that the department is aware of that, and these inspections will be carried out during the first week of school. We would like to applaud all the early childhood centers, administrators and staff, because we are conscious of the tremendous effort that was placed in getting those centers ready. A lot of time, financial resources, etc. was put into that. We would like to express our thanks to the Department of Environmental Health for working with us so closely, and also the St. Lucia Bureau of Standards, who help us develop the protocols which guide the operations at the centers. We would like to assure the public and reassure the parents that the protocols at the centers are stringent. Nothing was left to chance. Administrators have had to put a number of measures into place, and we would like to, as I said before, to commend them for that. We know parents are still a little uncertain, but we have done, and the administrators are doing the best that they can to ensure the health, safety, well-being of everyone. We would like to appeal to the parents to work with the centers and the administrators and to stick within the operating hours. The centers will be operating from 7 a.m. to 5 p.m. Parents, we urge you, as the centers have reopened, to please collect your children on time. Remember, we are still under curfew, so the teachers have to prepare, sanitize, deep clean the centers, and get home before 7 p.m. So again, we urge you
to work with us and collect your children on time. As stated, we are reopening the sector on a phased basis. We started with the private centers, and the government-operated centers will resume their operations on Monday, the 19th of April. Again, the stringent protocols ascribed for the sector will be in place, and we appeal to everyone to follow those guidelines, to remain alert, to remain vigilant, to take care and stay safe.
The National Enrichment and NELU Unit wishes to thank all its stakeholders, our coordinators, facilitators, learners, janitors, drivers, the principals and staff of the schools that we collaborate with, the management and staff of all establishments we collaborate with, for the continued support and patience during these times of uncertainty. The NELU wishes, therefore, to inform all stakeholders that we will be reopening classes on April 19, 2021 at 5 p.m. at all adult learning centers where the NELP and SKY courses will be implemented. The public is advised that registration is now open for NELP courses beginning in September 2021. Forms are available at the National Enrichment and Learning Unit located at the corner of St. Louis and Chisel Street. Forms are also available at the Accounts Department, 4th floor, Ministry of Education, and sub-offices of the Accountant General in Ancillary, Canries, Dennery, Meekwood, Vieux-Fort, and Soufrière. Remember to adhere to all COVID-19 protocols. Wash your hands, social distance, and wear your mask. For additional information, do not hesitate to call the NELU at 451-7717 or 730-0266, or email us at NELU-EDU2017@gmail.com. That is NELU-EDU2017@gmail.com.
We have gone into extensive consultations. We have spoken to various teams, from the Department of Health to our Central Teachers Union, to the National Principals Association, to our student councils, our National Youth Council, our parents likewise, in the webinar that we have produced for them. This is to say that at every point we would want to have what's best for our children. We are guided by the Department of Health as we move forward, and so we want us to continuously work together. Our counselors have been integral to a safe return of our children. So as we move as a Department of Education alongside the Department of Health, our hope, our desire is to have our children back as safe as possible, but also to make sure that at every instance we follow the science, reference their health and safety, and we put that at the forefront of everything that we do.